If you have persistent heartburn and acid reflux, you may be at risk for the precancerous condition Barrett's esophagus. It's estimated that as many as 2 million people may have Barrett's esophagus in the U.S., but there are no symptoms. Gastroenterologist Dr. Homan Zadeh reveals the danger of this condition and who needs to be screened.
Barrett's esophagus is a condition that we see in patients with heartburn and acid reflux. What Barrett's is a change in cells of the esophagus. So the esophagus, when it's exposed to acid over a long period of time, it undergoes a change in a cellular level. Barrett's esophagus has no symptoms unless you're scoped and unless we see the typical findings that we normally are trained to see in the esophagus. There's no way for one to know if they have a Barrett's esophagus or not. If Barrett's is not eliminated, it could turn cancerous. So that's why it is extremely important to know about this condition and to be screened for it. Typically, we know from our epidemiological studies that there are few risk factors that predisposes people to Barrett's esophagus. And those are being prolonged exposure to acid, usually greater than 5 years. Males tend to get it more than females do. Caucasians tend to get it more than other races do. Central obesity is a risk factor, and smoking is a risk factor, along with perhaps family history of Barrett's esophagus.
Medications have been used to control reflux and heartburn.
Typically, when we're talking about heartburn, we're talking about GERD and Barrett's esophagus. The cornerstone of treatment is eliminating acid. So that's achieved by using medications. The modern medications are proton pump inhibitors. Those are Nexiums and Prilosec and Prevacid and so on and so forth. The older generations were the H2 blockers, and those were the Zantacs and the Pepcids and the Tagamids. But none of that really cures Barrett's esophagus.
Dr. Zadeh talks about a new procedure for treating Barrett's esophagus.
What we have now and what we could do is actually burn off a layer of Barrett's esophagus during our endoscopic treatments. We have specialized catheters that we could apply short bursts of energy to, which heats up that catheter, that literally burns a thin layer of Barrett's esophagus in the area that we're working in the esophagus itself. And the idea being that once this area has burnt and it's been ablated, it will slough off, and there will be new cells regenerated underneath this Barrett's mucosa. So this procedure takes about half an hour or so to do, and it requires multiple sessions.
Results for this procedure have been remarkable.
The cure rate for this is at least 95%. And it depends on certain variables, such as the length of the Barrett's that is involved. But as a general rule, once Barrett's is diagnosed, there's no reason for one not to undergo this treatment. And after 3 or 4 sessions, to completely eliminate the Barrett's esophagus that they suffer from.